Hello, my name is Dr. Amjit Jolly, and I'm a cardiac electrophysiologist at St. Mary's General Hospital in Canada. The most important thing for me is that my patients have a safe and successful atrial fibrillation ablation procedure. There's nothing that makes me happier than seeing my patients in follow-up after their ablation with a resolution of their symptoms and a reduction in their medications. I exclusively use the CARDO electroanatomic mapping system for every single one of my catheter ablation procedures. Today, I will be walking you through your upcoming CARDO atrial fibrillation ablation, and then you will hear firsthand from one of my patients, Mr. Scott Thompson. Before we can schedule your procedure, all patients require a pre-procedural assessment and usually some pre-procedural investigations. During this assessment, you will have the opportunity to meet the medical team and often meet the physician who may be performing your procedure. This is also where you will learn about the expected benefits of the ablation procedure, long-term success rates, as well as the peri-procedural complication rates. Your medical team may order tests such as a 12-lead ECG, an ultrasound of your heart, known as an echocardiogram, pre-procedural blood work, and a CT or MRI of your heart that may be used during the procedure. These investigations are normal practice, although some patients may already have completed some of these tests even before they meet the medical team. The morning of the procedure, you will arrive in the pre-procedural prep area. You will already have received detailed instructions with what to do with your medications prior to the procedure. All patients arrive for their procedure in the fasting state. Please contact your medical team if you have any questions. In the hour or two before your procedure, you will have an intravenous inserted into your arm so that you may receive medications during your procedure. A team member will confirm your medications as well as your medical history. They will also confirm the last date of your blood thinner and what to expect after the procedure. When it is time for your procedure, you will be directed into your electrophysiology suite. There, you will meet the rest of the team that will help ensure that you have a safe and successful catheter ablation procedure. Once all the safety checks have been performed, you will receive medication to make you sleepy. Most centers in Canada will use a general anesthetic, but some centers may opt to perform conscious sedation instead. To start the procedure, the electrophysiologist will then insert small tubes into the veins in your growing area. Some physicians will use both sides, the right and left. Some physicians may use a vein in your neck or your shoulder as well. Once the tubes have been safely inserted, then the rest of the equipment is inserted through these tubes. A tiny needle is used to make a very small hole in between the right and left atrium. Once access to the left atrium has been obtained, high-dose intravenous blood thinners will be given to reduce the risk of a blood clot forming during the procedure. A series of RF applications, or burns, are then performed circumferentially around the openings of the 4 pulmonary veins in order to electrically isolate them from the rest of the heart. That way, even if one or more of the veins does go into atrial fibrillation, your heart will not go into atrial fibrillation. Once this is complete, all the catheters are removed from the body and the tiny hole between the right and left atrium closes automatically. You will be taken to a recovery area where all of the tubes will be taken out of your veins. The recovery team will then start to mobilize you over the next few hours. Some patients are able to go home the same day as the procedure. Please ask your medical team if this may be right for you. Once your procedure is complete, your medical team will arrange a comprehensive follow-up plan to examine the success of the procedure. Some patients may require a repeat procedure in their lifetime. This can be due to one or more than one of those burns healing up over time. Your medical team will discuss those details with you during your follow-up. Most patients will wear one or more outpatient Holter monitors to look for atrial fibrillation in the months after your procedure. Most patients can resume light activities within 48 hours and opt to return to work within 1 to 2 weeks of the procedure, depending on how physical their own occupation may be. It is critically important that you, as the patient, continue to take care of your health after the procedure. Please talk to your medical team about what you can do to improve the long-term success of the procedure.
Hello, my name is Scott Thompson. I suffered my first bout of atrial fibrillation when I was 50 years old. Our life was full and busy. My wife and I had been married for 20 years, and we had 3 wonderful children, all heavily involved in academic and athletic careers. My career as an airline pilot had been very challenging and rewarding, allowing me to travel extensively to Asia and Europe. Atrial fibrillation changed all of that. I was unable to work, losing the medical certificate which validated my airline pilot's license. Visiting our children in the United States became problematic due to the fact that it was very difficult for me to procure out-of-country health insurance. Performing anything more than just light work outside the house was very exhausting. The mental health aspects of not being able to live my life fully were significant. When Dr. Jolly at St. Mary's Hospital in Kitchener explained that I would be a candidate for an ablation procedure, I was overjoyed. As we carefully went through the whole preliminary vein isolation procedure, Dr. Jolly explained the potential benefits and risks associated with the procedure. I had no difficulty in agreeing to participate. A resolute and motivated team of healthcare professionals conducted the ablation procedure. Each member of the team explained what was going to happen and the purpose of each step. Now, I've spent a lifetime working as a team member, a team which at times was called upon to perform very complex tasks. This work experience makes me especially attuned to how people interact and treat other team members. I was extremely impressed with the compassionate care that I received and the level of professionalism of the entire hospital staff at St. Mary's. Most importantly, my recovery has been full and complete. A year after the procedure, I have no instances of atrial fibrillation, and I'm now able to hold a medical certificate that allows me to fly again. I can also obtain health insurance and travel out of the country. I have my life back. Thank you for listening to my story.